Hello everyone and welcome back. So in this video we're going to be continuing with our anatomy series. So what we're going to do in this video is continue and start to look at the joints. So far we've looked at the skin, we've looked at fascia, we've talked about the bones and what type of bones there are in the body. So now we're going to add in joints. So the first thing we're going to look at is what are joints. Then we're going to classify the joints into their different types of groups, and we're going to look at some examples of where some joints are located in the body. And then we're going to look at some clinical correlates and see why this is so important to learn. So let's get started. So what are joints exactly? So joints are basically connections, okay? They essentially join two bones together, okay? So if you think about it, if you picture your skeleton, if your whole human body was made out of bones and the bones were stuck together with, essentially just stuck together, they were screwed together, you wouldn't actually be able to move, would you? It would just be a statue. The reason why you're able to rotate and flex your arms and extend your legs and maybe rotate your neck and basically move your body in different kind of maneuvers, you're able to do that because you have joints, because the joints are the things that allow you to form different angles between your bones, okay? So as I say here, it allows you to move and bend your body instead of being a statue and not being able to move. So different joints, they allow for different levels of movement, okay? So there are some joints in your body, like your elbow, okay, that allow for flexion and extension, okay? There's your shoulder joint or your hip joint, okay, which allows full rotation and a wide variety of movement. Like you can look at your shoulder now and then move it up and down, sideways, forwards and backwards. You're able to do all of that, whereas your elbow is only really a one-axis kind of movement. There are some other joints as well in your body that allow for very, very limited movement, such as the joints that hold the bones of your skull together. Obviously, they have to be very, very tight and limit a lot of movement because you don't want any kind of injuries happening to your skull, do you? So let's look at the classification of joints. So joints, essentially, they're split into three groups according to the structure of the joint. So what the joint's made up of, basically. So the most common, okay, this is the most common type of joint in your body. It's called your synovial joint, and essentially you can think of this as a capsule around two bones. The other type of joint is called a fibrous joint. So from the name you can tell that it's made out of fiber. When I say fiber, that's like fibrous connective tissue. And then the last type is your cartilaginous type of joints. So we're going to go through these one by one. So let's start off with the synovial joint. So this is an introduction to a synovial joint. So when you think of synovial joints, you should think of a capsule. So here you have one bone and another bone, okay? So maybe you could say that this is your femur and then this is your tibia. Let's just as an example. So the synovial joint, it has an outer fibrous layer, okay? So it's the capsule, it's the covering of the joint, okay? So this is the outer fibrous layer here, okay? And it covers joints. So on the outside, you have a very thick fiber that holds the joint tightly in place. And then on the inside, you have this red membrane, which is this membrane here, which is known as your synovial membrane. Okay, easy to remember. You have a synovial joint and it's got a synovial membrane. And what the synovial membrane does is that it pumps fluid into this space here. Okay, so inside this capsule, you actually have some fluid. And the reason why you need fluid inside the capsule is it acts as a kind of lubricant. So these two bones, they're not hitting each other and scraping on each other. It acts as a slippery surface, so you don't get a lot of wear and tear of your joints. So the synovial joint, the second most important part of it is the synovial cavity, and that's filled with this synovial fluid. Okay, so remember that the fluid is made by the synovial membrane, and its job is to reduce the friction when the bones are moving. So it's very slippery, so there's not a lot of scraping and degradation of the bones. The third important structure of the synovial joint is that the bones are covered by a cartilage. Okay, so here you have your tibia, here you have your femur. Both of these are covered by a cartilage, and again it acts as a kind of protection for the bone, because even though synovial cavity, you still want a kind of helmet for the bone. You want a covering, a protective covering, so that when the bones do scrape each other, even though the synovial fluid is making it slippery, there's still an extra layer of protection to protect the bone from breaking down. So basically, these are the three most important parts of your synovial joint, and it is the most common type of joint in the body, and there's 6 types. We'll go over that later. So just as a recap, so here you have one bone and here you have a second bone. So if you want to build a synovial joint, okay, what are the 3 things that you need? The first thing you need, of course, you need a helmet for the bone. Okay, so that's the cartilage that's covering it. The second thing that you need is the synovial capsule. Okay, you need to, and then the third part is your cavity, of course. So if we put this on, let's put the caps onto the bones. Okay, those are your cartilaginous coverings of your bone, and then here we're going to draw the capsule. Okay, and then of course you've got your synovial membrane that's on the inside, and then what that's going to do, it's going to pump fluid inside so that you have your synovial fluid inside. Okay, great. Let's move on. The second type of joint is known as your fibrous joint. So from the word you can tell that the joint is made up of fiber. So unlike the synovial joint where there's a space between the bones, here it's essentially all fiber. There's no space in between. So immediately you can tell that the synovial joint will allow for a lot of movement. So you can look at your body right now, look at all the joints in your body, and you can tell that where you're able to bend and move, that's where a synovial joint is located. But the bones where there's little movement between them, that will tend to be a fibrous joint, where the bones are stuck together essentially, just to hold them in place. So the bones are joined by fibrous tissue. So there still can be some movement, but it really depends on how much tissue there is. So if you have one bone here and one bone here, and then you have fibrous tissue between it, compared to one bone here and one bone here and fibrous tissue, this move a lot more than this joint here. Okay, so as an example, you could say that this is the joint that exists between the bones in your skull. They're very tightly put together, and the fibrous tissue between the bones are very short. Whereas you can say that this type of fibrous joint might be located between the bones in your arm, for example, the bones between your ulna and your radius. So it allows for a little bit more movement in your arm. Okay, so here I've given these examples. So in the cranium, there's limited movement because the fibrous tissues are very short, whereas the fibrous tissue that exists between your ulna and your radius, they tend to be much larger, like this example here, and it's known as the interosseous membrane, for more movement. Okay, so here are some examples. So as I was saying, here you have a fibrous joint. Remember, a joint is located between two muscles, so it's to attach a bone to a bone. That's a joint essentially, and there's different types of joints. Like we've said, one type of joint is your synovial joint, which is like a capsule. The fibrous joint is like fiber, that's like a sheet of fiber that's connecting the two bones. Okay, but they're still both joints. So one example, as we said, is that between your ulna, between your radius and your ulna, you have this fibrous tissue that runs between them, and it's holding the two bones in place. Between the bones in your skull, okay, so here you can see your temporal bone here and your parietal bone here. The temporal bone and the parietal bone, they're stuck together with this, it's called a suture line, and in between the bones you have this kind of small, dense fibrous tissue that runs between them. And you'll see later on in one of the clinical correlates that we talk about, in babies, in newborns, this suturing line is much wider. It's much wider, so your baby has a much softer head, and that's because the fibrous tissues are quite long, so the bones are more movable. So here is your third example of a fibrous tissue, and this is actually quite an interesting example because it kind of makes sense out of a lot of things that we go through in our daily lives. So here is your tissue, the tooth to the bone here. This is your mandible, of course, okay, or your maxilla. So essentially you have a fibrous tissue here that's quite thin, and attached to the fibrous tissue, of course, you have some nerve fibers. So if you like place your two fingers on one of your teeth, on your molar tooth, and you try to shake it, the reason why it's so stable, hopefully it's stable, the reason why it's so stable is because the fibrous tissue there is short and it's connecting the tooth to your bone. But maybe when you're younger, or maybe now you have a wobbly tooth, That's because the fibrous tissue between the tooth and your bone is disconnected. It's no longer there. So that's the first interesting thing. So now you kind of already know why your tooth becomes wobbly and why it falls off. And that's because the fibrous tissue degrades. But also the fibrous tissue has another role as well. So have you ever finished eating and then you've felt like, I got something stuck in my tooth, okay, between my teeth? Maybe like it might be, I don't know, it might be some meat, or it might be something solid between my teeth. So you get a toothpick and you remove it. So where does that sensation come from? Where does that sensation of, there's something between my teeth? Essentially what that is that that's the neurons in your fibrous tissue between the tooth and the bone that's sensing that stretch in the fibrous tissue. So let's say, for example, this is normal teeth, and I'm kind of like spending a long time explaining this, but it's quite interesting. Okay, these are normal teeth, and then after you eat, okay, maybe you have one tooth here, and then this tooth is kind of like pushed because you have these teeth here are normal as well. So the reason why you can sense that you have something stuck in this part of your mouth is because the fibrous tissue here is being stretched by this piece of food. Okay, because let's say if you get a piece of food stuck here, what that's really going to do is push your tooth that way. So this fibrous tissue is going to get stretched. Okay, it's going to get stretched, and it's going to sense, oh, there's something stuck in the tooth, and then you're going to take a toothpick, and then you're going to take it out. Okay, so an example is your dentoalveolar syndesmosis. Right, so enough of that. So the final one is your cartilaginous system. So in your cartilaginous system, I said system, I meant joint. So your cartilaginous joint, as the word says, is made out of cartilage. So it's either the hyaline cartilage or fibrocartilage. So essentially, just remember that it is made out of cartilage. So there's several examples of plate. So remember, we went over this in the last lesson. Your epiphyseal plate is located here between the shaft and the head, or the metaphysis of your bone. Okay, and this is where your bone growth occurs. Okay, this is where you'll get elongation of. You also have cartilaginous. You also have cartilaginous joints between the ribs and your sternum, like so, as you can see here. And remember that the reason why you have cartilaginous joints there is because you want your ribs to be somewhat flexible and movable, because if it was just a cage, then it could be easily breakable. Whereas at least when you have the cartilage here connecting your ribs and your sternum, because the cartilage is made up of collagen, fibrous tissue, it's somewhat flexible. So if someone pushes on your chest, your ribs are not going to snap because the cartilage tolerates that pressure. In the same way, if you get hit in that area, or during your breathing process, there's room for your ribs and your sternum to open up, okay, to allow for more space. So essentially, your cartilaginous joints, they're there to hold your bones together, but also to allow for a little bit of flexibility. So we can see this as well in the vertebral, between the vertebral bones. So here's your vertebrae, and then over here you have your body of your vertebra. And in between the vertebral bodies, you have fibrous tissue. And obviously, this acts like glue because it holds your vertebrae together to create your spinal cord. But as well, what it's doing is allowing space, it's allowing that kind of, it has tolerance for you to be able to bend your spine forwards and backwards. Because imagine that this was like super glue and it just stuck all of your vertebrae together. It would be like your back would be a column, your spine would be a column. You wouldn't be able to bend it forwards or backwards because it would be like a pole, which is not good. So the third example is your pubic symphysis. So this exists between the pubic bones of your hip bone. So again, it's used as glue basically to stick your hip bones together, but it's also there to allow, for example, in women, this pubic symphysis is very useful for creating more space whilst giving birth. Yeah. Okay, so remember I told you that the most common joint in the body is your synovial joint. Or before we do go on, let's just take a step back and let's say that, okay, so joints, what are joints? Okay, essentially they are things that allow you to connect one bone to another bone. Okay, so what are the three types of bones? Okay, you can answer me. So the first type of bone is, of course, your synovial bone, your synovial joint, sorry. The second type is your fibrous joints, and then the third type is your cartilaginous joints. So your synovial joints, they're more like capsules. Capsules. And wherever you think of a bone that's able to move in your body, you can 99% of the time tell yourself that this is a synovial joint, because the capsule, it allows some space for your bones to be able to move. Fibrous joints, on the other hand, because they're made out of fiber and it's a sheet and there's no space, it's essentially there to hold the two bones together, as we saw with the vertebrae and the pubic symphysis and the skull bones. But of course, it does allow some movement, like some bending. It doesn't fuse them completely. And then the cartilaginous joints, these oh, sorry, I must have confused you there. I meant that the vertebrae and the pubic symphysis, these are cartilaginous joints, okay? The fibrous joints, they're there to hold structures together, okay, such as the joints between your skull bones and the joints between, for example, the ulna and the radius. They're there to kind of hold the bones together and allow for a limited movement. The cartilaginous joints, such as the pubic symphysis, the vertebrae, and the rib cage, where the ribs are attached to your sternum, these are there, yes, to hold the bones together in place, but it also allows for some kind of movement. For example, in the vertebrae, you're allowed to bend forwards and backwards, and in the pubic symphysis, it allows some kind of tolerance so that women can give birth a little bit easier. So this is the general principle of joints. So when you think of synovial joints, you have to remember that there are 6 different types of joints in the body. And that kind of makes sense, because if you look at your shoulder, okay, your shoulder joint, that's a synovial joint. And if you look at your elbow, that's a synovial joint. But why is it that you can rotate your shoulder and lift it up and down and sideways, whereas For your elbow joint, you can only flex and extend. You can't turn your elbow joint inwards. So why is that? And the answer is that these two are different types of synovial joints. Okay, the shoulder joint is a ball and socket joint, whereas the elbow joint is a hinge joint. So it's really important for you to at least get an understanding of the different types of joints in the body, so that you don't tell someone that synovial joints do the same thing. Yes, there are loads of different synovial joints in the body, but they're not all the same. So the first type, let's look at the first type. The first type is plane joints. Okay, so as you can tell from the word plane, it means flat, essentially. These joints, they allow for sliding or gliding of two bones on top of each other. Okay, so normally you'll find these joints where two bones are quite flat. So if you look at, so this is your sternum here. So at this joint here, this is a plane joint because these two bones are quite flat. The surfaces are quite flat. It allows for limited movement. Okay, so if you can see here, you can pretend this is one bone and this is another bone. It allows for gliding two bones on top of each other. Okay, it holds it in place, but it allows for slight movement. Okay, and here there's lots and lots of lots and lots of plane joints in the body, and they tend to be small, and that kind of makes sense because there's a lot of bones in the body that attach to each other, and even though they don't allow for massive movement like your shoulder joint, they're still synovial joints, and they're used to kind of create a little bit of movement between the bones, like so that it's not completely fused, but there's a little bit of movement. I hope that makes sense. So an example is your sternoclavicular joint. Okay, the second example is your hinge joint. So this is also a synovial joint, and it's the elbow joint that we were talking about. So a hinge joint, just like a door hinge. So here, if you have a door hinge, it allows for flexion only. It can't move you can't move the ulna or the radius horizontally at all. It's only flexion or extension in one axis. Okay, so the elbow joint is an example of that. The next type of synovial joint is your saddle joint, and it is exactly what it means. It's like the saddle that the horse rider sits on. So this joint, it allows for flexion, extension, abduction, and even. So what do all of those terms mean? If you remember them from terminology of anatomy, the first video, flexion is to close the angle, make it less than, make it a small angle, and extension is to create an angle larger than normal. And what I mean by that obviously doesn't make sense. What I mean by that is that you're increasing the angle. So it's like you're extending your elbow joint. That's extension, of course. And then when you bring your arm back up to your biceps, that's flexion. Abduction is you're moving your a part of your anatomy away from the center of your body, and adduction is you're bringing it back. So this is what a saddle joint allows. It allows you to flex, extend, it allows you to abduct and adduct. Okay, so a good example of this is your carpometacarpal joint right here. Okay, so the person will be allowed to flex, extend. So the next example is your condyloid joint. So your condyloid joint is a bit like your sliding joint, which was your plane joint, okay? Except there is a little bit of kind of concave and biconcave. So again, its range of movement is similar to the saddle joint in that it's allowed to flex and extend and abduct and adduct, okay? But instead of being located in your carpal metacarpal joint, it's really located in your metacarpal phalangeal joint, so the joints that are in your fingers essentially. Okay, so what's the ball and socket joint? So these are the big joints of your body, like your hip joint or your shoulder joint. So these allow for a lot more movement. So you can rotate them. You can extend. You can extend. You can flex. You can medial rotate, lateral rotate. In other words, you can do a lot of things because it's like you have a ball in a socket and you're able to move it around wherever you want, in whatever direction you want. And then you have your pivot joint. So your pivot joint is essentially a joint which allows rotation around one axis. So you can imagine here you have one bone and then you have another bone inserted into this pole, let's say. You can twist this, you can rotate this bone any direction you want, okay? I mean horizontally. And that's essentially a pivot joint. So an example of that is your axis and your atlas. So the axis, okay, if I draw your axis here, okay, at the top here, there's actually a spinal. Your atlas, okay, remember this is located at the C1, C2 level of your spinal column. Your atlas is inserted into this spinal process here, like this, essentially, just like this, okay? And so that's how you're able to rotate your neck, basically. So that's your pivot joint. So what I want you to kind of understand from this, and what you don't need to like go crazy and make sure that you learn this perfectly, but you should be aware of these types of joints that are in your body, and you should really understand mainly the three types of joints, okay, and the general principle behind them. And you should be aware of these different joints. You don't have to perfectly understand that this one allows flexion and extension and all that, okay? But you just have to be aware of it, have a good understanding of it, so that if you read it, you'll be able to grasp the concept that the textbook is giving you. Okay. So now let's look at the clinical box. So this is the interesting part of the lecture. So the first example is joints of newborn cranium. So I kind of hinted towards this at the beginning, but remember that we said that the type of joint that exists between the bones of your skull are, do you remember? The fibrous joints, right? Okay, so remember we said before that if the fibrous joint is really short, then it limits the movement between the bones, and that's what you can see if I go back. here, you can see here, look, the fibrous joint here is really, really narrow, so it creates suture lines as if it's glued the skull together. But this is in an adult, okay? In a newborn child, these suture lines are not fully formed yet. They're not fully matured. So the baby is born, yes, with fibrous tissue between the bones, but it's slowly gluing together. Okay, so at the beginning, the fibrous joints, they're quite long. So the bones of the skull, it's not like one solid object. It's kind of soft because the bones, they're not fused together yet. So what happens is that slowly, the bones will get stuck together because the fibrous tissue will become shorter and shorter, and then this will eventually fill up like this into an adult skull. So that's why if you handle a baby, you should be very, very careful with the baby's head, because the bones of the skull are not fully fused together yet. You could easily injure the baby. And one thing that you should never do is that if you feel like, because what can happen sometimes is that when a baby is born, when a baby is passed through the mother's vaginal canal, there's immense pressure that the baby has to squeeze himself through. And then what that does, sometimes to some babies, is that it can force liquid into their skull, okay, into the skin of their skull. So the baby will be born sometimes with conditions known as a cephalohematoma or a subgaleal hematoma, or another term called caput succedaneum. I think I pronounced that correctly. But essentially, that's from all that pressure that comes from going through the vaginal canal. And so what we're taught in medicine is never stick an injection into the baby's skull where the liquid is to remove the liquid. Never do that, because as you can see, the bones are not fully fused yet. So imagine you stick a needle into the baby's head and the needle is contaminated. That's a quick way to get meningitis or encephalitis for the baby. So you want to avoid that, okay? So essentially, basically any kind of gap, any kind of gap that's in the baby's skull between the bones are known as a fontanelle. Okay, so the anterior and the posterior, the anterior fontanelle is the largest gap in the baby's head. So this is a fontanelle here. This is a fontanelle because it's the area where the bones are not fused yet, and the posterior fontanelle is also quite large as well. So if you take your finger and you stick it, or you kind of press it on the baby's anterior fontanelle, like kind of above the forehead, it will feel really soft, and that's because you're pressing on the fibrous tissue, not the bone, because the bones are not fused together. Okay, so that's the soft spot of the baby's skull. So another kind of interesting clinical thing that I think that you should really remember this definitely, is that because the baby's skull is quite soft and it's not fully formed yet, it's almost like you could almost mold it in a way, because it's quite malleable. So one thing that you should always do with a child is never leave a child laying down in its cot for too long, because what can happen is that the skull the pressure that is formed when the baby is putting their head on their cot, it molds the skull into a different shape. And so in some babies, you could actually see a flat occiput, so a flat posterior part of the head. And that is a massive sign of neglect. So if you ever see a child that has a flat occiput, then the immediate thing that you should think of is that these parents are not taking care of this child very well, because in other words, they've left this child for a long time in one place and they haven't tended to it. And normally this condition is associated with visual blindness. And maybe you could guess the reason. So the reason is that if this is your brain, if this is the child's brain here, okay, this is the spinal cord, the posterior part of the brain, the occipital part of the brain, is associated with the eyes. So you can imagine that if there's a lot of pressure on the posterior part of the skull flat, then you're kind of destroying the part of the brain. So in other words, the eyes or the child's vision will be diminished. Okay, so another clinical correlate. So I hope you found that kind of interesting. This is another clinical correlate. So this is degenerative joint disease. So joints are very essential, remember, to help you move, but also to protect the bones from one another. Remember, in the synovial joints, one of the main things was that the bones have a protective cap on them, and that's made out of cartilage. So what can happen sometimes is that over time, these protective caps or the joint itself, it can become destroyed for whatever reason. And then that can cause a lot of pain because the bones will start to scrape on each other. Instead of it being slippery and there's a lot of room, the bones will begin to scrape on each other, and it can cause a lot of problems. Okay, so an example of this, an example of a disease that causes degenerative joint disease is osteoarthritis, and essentially that is the destruction of the joint because there's too much pressure. So a lot of the time, the reason for this is that the patient is old. So in other words, the patient has been using the joint for a long period of time, and especially if the patient is a labor worker where they're constantly moving and there's a lot of pressure on their joints, they can get osteoarthritis. And the second type of patient that can get osteoarthritis are obese patients. And the reason for that, again, you have a lot of pressure that's on your bones. So all of this pressure, eventually, after years and years, what it's going to do is going to break down all of that protective layer in the synovial joint, and the bones will begin to scrape on each other. So this is an example of osteoarthritis. So you can see here the cap of the synovial joint that's protecting the bone. It's degraded, and now the joints are rubbing against, the bones are rubbing against each other, and it's causing a lot of pain and inflammation. So the second type of degenerative disease that's often associated with joints is rheumatoid arthritis. So everyone must, or most likely, knows someone that suffers from rheumatoid arthritis. And essentially, rheumatoid arthritis is an immune condition where the immune system begins to attack the joint. And when it attacks the joint, it's going to remove that protective layer between the two bones, and then the bones will begin to scrape on each other, and that can cause all of those pains of the pains that these patients complain of. Okay, so you can see here, this is osteoarthritis. This is a normal joint, and here you can see the bones are now fusing together. They're coming together and they're scraping because there's no more protective layering between them. This is rheumatoid arthritis, so you can see here a very healthy protective layer between the two bones. Is that these immune cells, they start to attack the joint, and it starts to break down and the protect each other and even fuse. Okay, so this is a classic sign that you see in rheumatoid arthritis patients. You have these botanier deformities and the swan neck deformities of the fingers, and this is essentially where the bones are now fusing together. They're almost becoming one bone, and it forms this weird swan-like deformity. Okay, so the third clinical correlate of this lecture is the arthroscopy. So if someone has a condition, maybe they have a sports injury where they might have injured their ACL or torn their ACL. What we like in other kind of diseases, maybe in a liver disease, you use an ultrasound, or a neurological disease, you use a CT scan. Well, when it comes to joints, a lot of the time when we want to observe what's going on inside the synovial joint, we can use arthroscopies. So this is essentially a camera visualized woman is using on this patient, and it's used to examine the, or maybe like torn menisces or other problems that exist inside the joint. So again, no need to go too much into detail, but just remember that an arthroscopy is used to look at the inside of a synovial joint. Okay, so that is it. Hopefully I didn't spend too long. I do kind of take a little bit of time when it comes to explaining things. If you feel like I should speed up and I don't need to spend so much time on the small details, then you can let me know whatever you guys feel is most comfortable. But I do like to explain things, especially because this is aimed at people who are just starting medicine and who are learning anatomy in these subjects for the first time. But anyway, if you did find this useful, please do like and subscribe. I would very much appreciate the support, and I will see you next time. Thanks a lot.